Artificial intelligence, or AI, it's pretty much everywhere these days, but is it ready to handle our most precious asset, our health? And maybe the even bigger question is this: is our healthcare system ready for AI? Let's dig in and find out.
Just think about it for a second. Your last trip to the doctor, maybe a recent scan you had, or even just how your appointment was scheduled. Could AI have been quietly working in the background? The answer right now is maybe, but pretty soon it's going to be a definite yes. This transformation is already happening.
So to get some real answers, we're diving into this incredible report from the World Health Organization. They actually went out and gave the entire European region its first ever AI checkup. They talked to 50 different countries to see who's really leading the charge and who might be falling a bit behind.
All right, here's our game plan. First, we're going to meet the navigators, the ones setting the course. Then we'll talk about the change makers, the people. After that, we'll look at the guardrails and backbone needed for safe data, weigh the promise versus peril, and finally, map out the way forward.
Okay, first up, the navigators. I mean, you wouldn't build a brand new hospital without a blueprint, would you? Of course not. And it's the exact same idea for AI in health. You've got to have a national strategy, a map that clearly says, okay, this is where we're headed, and here's how we're going to get there safely.
In these strategies, they are absolutely crucial. They lay out the vision and, just as important, the rules of the road. This makes sure that AI is actually serving real health needs and not just, chasing the latest shiny tech trend.
So you'd probably assume every country has one of these health-specific maps, right? Well, brace yourself, because this is a bit of a shocker. Only 8%. That's it. Just 4 out of 50 countries have a dedicated game plan for AI and health. It really shows a huge gap between ambition and actual action.
Now, for those few countries that do have a plan, they've got a choice to make. Do you go for a super focused health-only strategy that lets you move fast but might create its own little bubble? Or do you weave AI into a bigger national plan, which is more efficient but might not get the specific details of healthcare right? It's a classic trade-off.
So let's keep building on that, because a strategy is just a piece of paper if you don't have the right people to make it happen. And that brings us to the change makers. Is this whole revolution actually being built with patients and doctors at the center of it all?
And this tells us exactly who has a seat at the table. So you've got government officials, you've got AI developers, they're well represented, but look at this. Patient associations, they're only involved about 42% of the time, and the general public, a mere 22%. I mean, if this tech is supposed to be for patients, shouldn't they have a much, much bigger voice in how it's designed?
And at the same time, we're seeing this massive training gap. Think about it. You can have the most advanced AI tool in the world, but if doctors and nurses aren't trained to use it properly, what's the point? Right now, almost no one is building AI into medical school. It's kind of like giving someone a spaceship, but forgetting the flight school.
Okay, next, let's talk about the absolute foundations of all this. How do we make sure these incredibly powerful systems are also safe and trustworthy? Well, it really boils down to 2 key things: the guardrails, those are the legal and ethical rules, and the backbone, which is the high-quality, secure data that AI needs to even work in the first place.
The WHO's regional director for Europe, Dr. Hans Klug, he put it perfectly. He said there's inspiring progress for sure, but we absolutely cannot afford to get complacent. The stakes here are just way too high.
Building that data backbone, it happens in stages. And most countries have started. They have a data strategy. They're building secure hubs. But that final crucial step, issuing clear guidance on how to actually reuse that data for research and innovation, that's missing in more than 2/3 of them. It's like the foundation is there, but the pipes aren't fully connected yet.
Okay, so we've seen the gaps in strategy and people and data. Now let's get to the real heart of it, the incredible promise of what AI can do versus the very real perils that are holding it back.
And the promise is just immense. I mean, look at this. There's almost universal agreement on the big goals: better patient care, taking some pressure off our overworked doctors and nurses, and making the whole system run more efficiently. These aren't just buzzwords. These are real solutions to the problems we all see in healthcare today.
But then, you have the peril, the single biggest barrier stopping all this progress in its tracks: legal uncertainty. A whopping 86% of countries pointed to this as a major headache. Because if a hospital or a doctor doesn't know who's liable when an AI algorithm makes a mistake, well, they're going to be pretty hesitant to adopt it, right? So how do you fix that? Well, one really promising idea is something called a regulatory sandbox. Think of it like a flight simulator for new tech.
It lets developers and regulators test out new AI tools in a safe, controlled way so they can find and fix problems before the technology ever gets near a real patient.
So, after this grand health checkup, where do we go from here? The great thing about the WHO report is that it's not just a diagnosis of the problem, it's also a prescription for the future. It really is a map for what has to happen next.
The path forward is pretty clear. It all starts with solving that legal uncertainty by setting clear rules. It means bringing patients into the conversation from the start, not as an afterthought. It demands we invest in training our healthcare workers, that we lock down our data, and most important of all, we have to make sure AI serves real health goals, not just a company's bottom line.
And that all brings us to the final and most crucial question. The potential for AI is just undeniable. But as we move forward, we have a choice to make about the kind of future we're building. Is AI going to be a great equalizer, a tool that brings better healthcare to everyone, everywhere? Or will it become yet another technology that just widens the gap between the haves and the have-nots? The answer to that really depends on the choices we all make, starting right now.